Varicose veins are caused by incompetency of the valves of the veins. So arteries have high blood pressure to allow blood to go all the way down to your feet. But the veins, they are a very low pressure system, so they rely on valves throughout the entire course of the vein to get blood back up to your heart. As we walk or move around, our muscles squeeze, which causes the blood to kind of move through the veins, and then the valves shut, which kind of allows it as a step ladder kind of pattern to get back up to the heart. When there's incompetency of the valves, for many different reasons, a lot of it's familial, or women are more prone to it due to the high levels of progesterone that they face during pregnancy. Standing on your feet all day for your job, that's a big risk factor for them. The pressure that's on the valves ends up causing the veins to dilate, and the valves are no longer able to completely shut, which then causes them to be what we call leaky. So it allows the blood to go back towards your foot, which is where it never should go. It should always be headed towards your heart. And what that ends up doing is causing the vein to dilate even more, and even more valves become incompetent, and then you can end up getting the varicose veins and the ropey veins that you see on some people's legs. So our legs have two sets of venous systems. We have a superficial venous system and a deep venous system. The deep venous system you've probably heard of a lot when people say they have a blood clot in their legs. The ones that we're concerned about are going on a long flight and getting a blood clot in their legs. The superficial system is the one that you can see the varicose veins. So as long as the deep system is open and competent, then you can shut down the superficial one without any concerns or problems. So the first thing that we start off with are compression stockings. We always want our patients that have varicose veins or that are on their feet for a constant period of time to be wearing compression stockings. That pressure always pushes on the veins and doesn't allow them to fully dilate or become incompetent if you're trying to prevent it, or keep them compressed if you already have the varicose veins. After that, then what we can offer is called laser ablation, endovenous laser ablation. So we can actually puncture the vein and take a laser fiber up to the area of the groin where the vein starts, and basically cause it to clot off from the inside. And once it does that, it over time usually just shrinks down and then goes away, and all those ropey veins that you see on the legs are gone.